103.8.
So Abu Dhabi's HOPE Consortium was set up last year with the mission to distribute millions of vaccine doses around the world. The group's made up of the Department of Health Abu Dhabi, Etihad Cargo, Abu Dhabi Port, Makta Gateway, Rafid and Skycell. And they're all working together with UNICEF to ensure that vaccines donated by countries such as the US are safely delivered in the developing world. So the consortium supply chain network has already handled over 200 million doses of vaccines, contributing basically to the inoculation programme in over 40 destinations worldwide. And of course, the initiative is in line with the COVAX project, which is led by the World Health Organization, to try to ensure that people in all parts of the world are immunised against COVID-19. Joining us now is Dr. Omar Najim. He's the Executive Office Director of the Department of Health Abu Dhabi, who are one of the key participants in the consortium. Joining us on Microsoft Teams. We're also live on Facebook if you'd like to watch us. Dr. Omar Najim, thank you for joining us. How are you?
I'm very good. Pleasure to be with you today. Thank you for having me.
Oh, well, we really appreciate your time because, of course, this is an ever more pertinent question with the World Health Organization regularly calling for more equitable distributions of vaccines. There are, however, logistical issues. What are the challenges that the HOPE Consortium faces and the challenge that you're able to overcome?
Sure. So as you mentioned earlier in your introduction, the HOPE Consortium is almost 1 year old, and since establishment by the different partners you mentioned, we managed to have updated number for you. So 250 million doses of vaccine being handled by the HOPE Consortium partners to over 60 countries. These countries ranging from all the way to Australia, to South America, Europe, and Africa, of course, and the Middle East. Now, the challenge of transporting, storing and distributing vaccines is always a specialized one, because in the best of times, even before the pandemic, you need to manage the transport of these vaccines in the most careful way in order for that vaccine to arrive at the right place, the right time for the right individuals, and still be effective and managing to achieve what is supposed to achieve, which is providing protection to the individual receiving them. So before the pandemic, most of the vaccines need 2 to 8 degrees Celsius. As we progress through the pandemic, new technologies of developing vaccines has come to the fore, including vaccines that need -80, if you can imagine that, and -20 as well. And that's now most of the vaccines being transported. So for that to happen, every single step along the way, from where the vaccine leave the factory all the way to the vaccination center, being it in a hospital or a tent or a clinic in the middle of nowhere, the Himalayan, the Tibet and the Himalayas, or a metropolitan like Dubai, need to be managed in the right way. That temperature need to be kept with a very specific range, so it doesn't deviate around it. The security of these vaccines need to be maintained and monitored all the time. And then it need to be in tandem, where you're managing the inventory in order to match a vaccination program. And hence the creations of the HOPE Consortium. We brought the best of what the world got to offer, local and international players, to address every single step along that journey, to manage it in the most impactful way, to achieve the speediest vaccination program around the globe.
I mean, 250 million, I'm so pleased that you updated our numbers there. That's an incredible amount of vaccines coming through Abu Dhabi. Why is the UAE such a good logistical centre for this type of operation?
I think it's a testament to the leadership investment on Abu Dhabi, and UAE invested heavily into infrastructure that enable it. Now, if you combine both Abu Dhabi and Dubai, UAE now is the biggest logistical centers for vaccine passing. So the fact that we have the infrastructure in terms of airport, Abu Dhabi airport, we have the infrastructure in terms of the storage capacity. So the storage capacity in Abu Dhabi ports can handle up to 9 billion vaccine doses in 1 year. That's the different vaccine temperatures being at 2 to 8, minus 20 or minus 80. And the collaborative approach and philosophy that it's proven that to be one of the most important elements to mount a successful one. So the openness to collaborate beyond professional boundaries, commercial boundaries, political boundaries, and even geographical boundaries in order to achieve a specific target that we all focused on. And I think that is lending itself well, not only for helping the world in getting out of the pandemic as fast as possible, but also setting Abu Dhabi and UAE well to be a life science logistical hub going for the future. The accumulated experience, the accumulated capacity and capability and network already established is putting Abu Dhabi firmly and UAE firmly on the map for the life science future around the world.
Is this a charitable enterprise? Is it part funded by grants, or is it a commercial exercise?
No, it depends on the client we're dealing with. So if I can draw you at the landscape of the different people we're collaborating with in terms of delivering these vaccines. Some of it is by UAE government or other governments who want to transport vaccines for charitable reasons, and we help in doing that. Some of them are pharmaceutical companies or countries waiting to receive their vaccine doses from pharmaceutical companies, and we help them do that on a commercial basis. And some of them are freight forwarders clients who say, okay, I want to use the storage capacity that you guys got, or the expertise around, or the network that you have in terms of Etihad cargo reach, and I use either one element of which or the whole element of what you provide. And then we go into commercial dealing on that basis. That said, we are a contributor to COVAX, we collaborate with UNICEF, and we collaborate with many others around us.
I mean, some of the successes that I'd read about over the last few months include some of these incredible freezers that can keep vaccines at minus 80 degrees. Why? I think you sent several to Africa, for example. Why were they so special, so key?
So it's very important we go back to the key principle that everybody talk about vaccine and how important vaccines. So let me give you this saying. So vaccines do not save life. What saves lives is vaccination program. So in order for the vaccine to be used to the most of its potential in terms of providing immunity against the virus, you need a successful vaccination program. Now, the successful vaccination program, it means you can't just say, I'm going to send this 1 million doses to a certain country, and then I'll land in the airport, I'll leave it there and leave. I'll put it there and leave. What you need is to look at the vaccination program in that country. So if that country only able to manage 100,000 doses a month, there's no point in giving them a 1 million in one go. You need to manage it, and you need to look at the infrastructure readiness in these countries in order to store it and in order to distribute it in different areas. As we were saying earlier, most of the vaccines nowadays, or the vaccines that are well known as part of the vaccination efforts around COVID-19, require minus 20, minus 80. Of course, there are the vaccines that require 2 to 8. Now, for that, you need an infrastructure that in the past, prior to COVID, did not exist. And also you need individuals who are able to and trained to handle these vaccines in the most efficient and effective way. And as what we did, and we collaborated with UNICEF, is said, well, the first thing before you get the vaccine, you need to get the freezers to store these vaccines, and along the freezers, the other infrastructure, and to make sure that these freezers will be used in the most impactful way. And that's what we did. So we worked with UNICEF, we got the freezers, and we distributed to over 20 countries in Africa, following a careful assessment of the infrastructure needed to handle these vaccines. And what that allows these countries not only is to expand the ability and the limits they have with only getting 2 to 8 degrees Celsius, now to possibly get more of the minus 20 and minus 80 degrees Celsius, which means more vaccination program, more successful one and more people reached.
I mean, obviously, that was one of your big success stories, getting those. There were dozens of freezers sent to Africa to be able to cater for those vaccines. Can you give us a hint about some upcoming successes or what the consortium's working on at the moment?
I think that some of the other elements around the same theme of vaccination program, successful vaccination program. So some of it now we are introducing the other steps post arrival of the vaccine in a certain country. So we are looking at what's the training available, what's the capability and the capacity of the staff that is going to deliver the vaccination program. Have they handled these vaccines before, and can we help in that regard? And what we did now is we are enabling, as part of the offering within the HOPE Consortium, is to say to country, we're not only going to provide you with the vaccine if you need it to, but also we're happy to upgrade the training, the capability and the capacity of your staffing in order to deliver a successful vaccination program. There are many other elements looking at clinics, the mobile clinics. Is there a need for it? Could we help in that regard? One of the key elements that we also providing is what Maqta Gateway, which is the digital arm of the HOPE Consortium. What it does, it follows every single vaccine along its journey, from leaving the factory to arriving at or being used to inoculate a person anywhere around the world, to provide three things. Where is the vaccine at any single point along its journey? What's the inventory like, and how can we manage it to the maximum effect of achieving a successful vaccination program? And third, it's what's the temperature of that vaccine along every single journey. So if there is a temperature excursion happening or a risk of a temperature excursion happening, then an intervention happen fairly quickly to prevent that and to reduce any wastage.
It's absolutely fascinating to hear about the practicalities required in getting the vaccine actually into people's arms. It sounds like the work you're doing there is really extraordinary and very, very satisfying. Dr. Omar Najim, thank you so much for your time. Really appreciate speaking to you.
Absolute pleasure. Thank you very much.
Thank you very much indeed. So that's Dr. Omar Najim, the Executive Office Director at the Department of Health Abu Dhabi, which is, of course, one of the key participants in Abu Dhabi's HOPE Consortium. Really interesting to hear about their work. We will be covering their story going forward and staying in close contact to find out exactly how their progress advances throughout the developing and European nations. Right, up next, we are going to be returning to that key hot topic.